The procedure of doing a hair transplant here at Nova Medical is first do a nice consult with the patient. What is their problem areas? Where do they need improvement? And usually these problems are really evident. They show us the areas that they're having problems. If they're in their 20s, it's usually in this area right in here, the frontal temple area. If they're in the 40s, it's usually here as well as in the crown. And it just really bothers them. So we get a nice treatment plan for them. Look at their donor site, and as long as the donor site has a lot of density and the hair in there is thick enough to be able to transfer, they're a wonderful candidate for that. So then they show up for the day of the procedure. On the day of procedure, we give them some local anesthesia as well as some nitrous gas, so that's basically pain-free. They don't feel much at all, mostly just pressure. During the procedure, they're usually kind of sleeping a little bit. After having injected the medicine, again, there's no pain. After all of the donor site has been harvested, we take the grafts to the back, count them out, see exactly how many numbers of grafts that we have, clean them up so that they're precisely ready to be transplanted. And then during that time that we're kind of filtering through the grafts and getting them prepared, they have like a little lunch just to get rehydrated, get some lunch, go to the bathrooms, again, to keep them comfortable. Once that's done, they come back, they get into a different position so we can start transplanting the hair that has been removed from the donor site. I inject, give again some nitrous gas so they don't feel it. Put the grafts in, one by one, basically make a little hole, put the graft in and do it so that it's as natural as possible, making sure that the hair alignment is in the proper direction and that the density is going to give them a very nice result. What we see is that 97% of all the patients that we have are super satisfied with their results on the first session, but there are some times when a second session needs to be done, and that's on patients that are a little older that have a little bit more thinning, or in a younger patient that as they age, they're still losing some of their own native hair, and they just need to have almost like a little second redensification process. We also encourage to do supplements and basically medical therapies, which is using finasteride as well as minoxidil, as well as supplements, as well as PRP to help make that hair that we've transplanted, as well as the hair that they have had since birth, to continue growing nice and strong and continue to be nice and thick.